Section 4. Understanding the requirements of ISO20387:2018. Biotechnology, Biobanking, General. Requirements for biobanking. Learning objectives. Following completion of this session, participants will be able to: why is biobanking important? What is ISO 20387:2018 is biobanking ethical? Quality control requirements in ISO 20387:2018. Read more at the ANSI blog. ISO 20387:2018. General requirements for biobanking https://blog ANSI.org/ What are biobanks? Biobanks are collections of human biological tissue or fluid specimens for scientific research and healthcare. They are collected for research to improve the understanding of health and disease. Hence, the biobank functions as a medical archive for researchers. The goal of biobank research is to yield novel insights into the genetic component of disease, facilitating a more personalized process to collecting health data. Biobanking activities may also include the collection of animal, plant, fungus, tissues, and microorganisms for research and development. Types of biobanks. The types of information and samples collected from biobanks depend on its specific purpose of the biobank. Population-based biobanks provide specimens from individuals of a general population or region. They are focused on studying the role of individual genetic susceptibility and exposure to external factors in the development of particular disorders by linking molecular data with other related information. Disease-oriented biobanks collect disease-specific biospecimens. They are focused on a single type of tissue or include biospecimens from different sources that are relevant to a particular disease like cancer. Which places create and use biobanks? Hospitals, research centers, universities, nonprofit organizations that study specific diseases, pharmaceutical companies. Why is biobanking important? For over 100 years, human specimens have been collected and stored for research purposes. The initial specimen banks based their operations on the needs of a specific study, storing samples in a singular freezer for predominantly academic research. In time, the scope of biobanks grew to include more general research claims. This research trend continued over the following years with more disease-centric biobanks, population-based biobanks, and biorepositories for animal tissue, plant seeds, and more. Therefore, due to the worldwide proliferation of biobank research, quality control requirements for organizations performing biobanking became necessary. ISO 20387:2018, Biotechnology, Biobanking. General requirements for biobanking details those requirements. Why is biobanking important? Biobanking refers to the process of collecting human biological tissue specimens, and also animal, plant, fungus, tissues, and microorganisms to discover related health and medical data. By using molecular and clinical data from patients, biobanks help to develop more targeted therapies and determine disease predisposition, helping detect and prevent the onset of diseases like cancer. They are pivotal in medicine discoveries and development, serving as an important tool for the advancement of life science research. Why is biobanking important? Biobanks are a key component of performing modern medical and healthcare research, producing many research studies with significant implications for improving health. Researchers have learned from studies using samples from biobanks about safe and effective treatment doses of anti-seizure medications, medicines used to treat heart disease or genetic changes, and medicines used to decrease a person's risk for osteoporosis, rheumatoid arthritis, asthma, or certain cancers. Introduction to ISO 20387:2018. ISO 20387:2018 is the international standard for the competent, impartial, and consistent operation of biobanks. This standard applies to all organizations performing biobanking. It details that the following appropriate and relevant processes occurring in the life cycle stages of the biological material and associated data in the biobank shall be defined and verified. Introduction to ISO 20387:2018. The processes include collecting / procuring, acquiring, and receiving, tagging, accessioning / logging, cataloging / classifying, examining, preparing, preserving, storing, managing data, destroying, packaging, and safeguarding, distributing, and transporting. Is biobanking ethical? Biobanks involve storing and operating with specific personal information from human samples. As a result, biobanking is associated with a broad spectrum of ethical, social, and legal issues. It is necessary to consider all kinds of information from clinical informatics, treatment, outcome data, databases, inventory management, national policies, intellectual properties, and patient-informed consent. Required when research involves the participation of human beings, genetic material, personal data, or biological samples. Informed consent in research ethics addresses privacy issues and means that prior to consenting, participants should be told the goal of their participation and the research involved, possible risks and adverse event, and the possibility to refuse or withdraw from research at any time. Another important consideration is data protection and confidentiality, which includes access to data and the conservation of data, enabling participants to have control over their personal data. It guarantees the right to privacy and that all personal data is safe from unforeseen malevolent use. Is biobanking ethical? Informed consent consists of 3 basic components: adequate information, voluntariness, and competence. It means that prior to consenting, a participant should be informed of the goal of his participation and research, possible risks and adverse event, and the possibility to refuse or withdraw from research at any time. Informed consent is required when the research involves the participation of human beings, when the research uses genetic material or biological samples, and when the research involves personal data. Informed consent should respect individuals' autonomy and vulnerability. Special attention must be paid to specific groups of participants like children, elderly, mentally deficient persons, severely injured patients, and participants with specific cultural or traditional background, ethnic specificity, and so on. Quality control requirements in ISO 20387:2018. ISO 20387:2018 includes quality control, QC, requirements to verify the quality of data collections, biological material from multicellular organisms, e.g., human, animal, fungus, and plant and microorganisms for research and development. QC includes implementing procedures to ensure compliance with relevant biosecurity and biosafety. Quality control requirements in ISO 20387:2018. Biosafety. Containment principles, technologies, and practices that are implemented to prevent unintentional exposure to pathogens and toxins or their accidental release. Biosecurity. Institutional and personal security measures and procedures designed to prevent the loss, theft, misuse, diversion, or intentional / unintentional release of pathogens, genetically modified organisms, toxin-producing organisms, or parts thereof, as well as such toxins that are held, transferred, and or supplied by the biobank. Quality control requirements in ISO 20387:2018. The standard maintains that the biobank shall define a minimum set of QC procedures to be performed on the biological material and associated data or a subset of it. Specifies QC requirements for a biobank's processes and data processes. The biobank shall establish, document, implement, and periodically analyze procedures specifying QC activities throughout the biobanking processes. This includes QC criteria corresponding to predefined specifications to demonstrate fitness for the intended purpose of the biological material and associated data. Data. The biobank must define the type and frequency of the QC performed, and the QC should focus on the accuracy, completeness, and consistency of data. Question. Any questions? For general requirements, 4.1 General and Impartiality. For 0.1.1 Biobanks. Biobanks. Black small squares shall have procedures for each type of biological material, and associated data held black small squares shall include collecting, receiving, tagging, accessioning, classifying, examining, preparing, preserving, storing, managing data, destroying, packaging, distributing, and transporting. Black small squares shall have procedures to ensure compliance with biosecurity/biosafety requirements. Black small square procedures shall address risks and opportunities using a risk assessment. For general requirements. For 0.1 General and Impartiality, 4.1.2 Biobank should be aware of downstream applications for biological material and associated data to enable reproducible research. 4.1.3 The biobank mission should be defined and available. 4.1.4 Biobank activities. Processes and procedures shall be documented. 4.1.5 Biobank documentation shall include information regarding the QMS as well as management of facilities/dedicated areas. For general requirements, 4.1 General and Impartiality. For 0.1.6 Biobank shall comply with relevant regional, national, and international ethics requirements for biological material and associated data. For 0.1.7 Biobank shall document the identity of personnel performing procedural activities. For 0.1.8 Biobank should define time period for retention of documented information and associated data for each biological material after its distribution, disposal, or destruction. For general requirements, 4.2 Impartiality. For 0.2.1 Biobanking, black small square shall be structured and managed to safeguard impartiality. Black small square, is the biobank able to demonstrate this? For 0.2.2 Biobank management, black small square shall be committed to impartiality. Black small square, is the biobank able to demonstrate this? For 0.2.3 Impartiality, is the biobank's responsibility internal or external pressures shall not compromise impartiality. Black small square, how is this demonstrated? Question. Any questions? Questions? For general requirements, 4.2 Impartiality. For 0.2.4 Biobank shall identify risks to impartiality on an ongoing basis and include those arising from minus its activities minus its relationships minus relationships of personnel. For 0.2.5 Risk mitigation. If risk is identified, the biobank shall demonstrate how risk to impartiality is eliminated or minimized. Question. Any questions? For general requirements, 4.3 Confidentiality. For 0.3.1 Biobank, black small square shall protect the confidential information and rights of donors. Recipients and users, black small square, inform the provider/donor in advance of the information it intends to place in the public domain. For 0.3.2 Biobank, through legally enforceable commitments, black small square shall manage all information obtained or created during the performance of biobanking. Black small square shall inform provider/donor, where possible, how privacy and confidentiality are protected, shall only release information according to agreements and approvals. For general requirements, 4.3 Confidentiality. For 0.3.3, when required by law to release confidential information, though, provider/donor shall be notified of information provided unless prohibited. For 0.3.4, all personnel with biobank access bound by confidentiality. Question. Any questions? 5 Structural requirements. 5.1 Legal status, black small square, the biobank shall be a legal entity responsible for activities. 5.2 Biobank management, black small square, identify management that has overall responsibility for the biobank. 5.3 Biobank shall have a governance body, advisory board. Black small square body provides advice on scientific, technical and administrative matters. 5 structural requirements. 5.4 Biobank is responsible to activities in its facilities/dedicated areas. 5.5 Biobank shall have a course of action to define and address liabilities arising from activities. 5.6 Biobanking shall conduct activities as to meet the requirements of Black Small Square, the standard Black Small Square customer requirements, Black Small Square regulatory authorities, Black Small Square accreditation body. 5 structural requirements. 5.7 Scope of conformance. The Biobank Black Small Square shall define and document the range of activities to which it claims conformity to the standard Black Small Square shall only claim conformity for its defined range of activities excluding externally provided activities. 5 structural requirements. 5.8 Biobank Black Small Square shall define the governance structure, including biobank organization and management. Black Small Square define the biobank's place in any parent organization and the relationship between management. Technical operations and support services. Black Small Square specify the responsibilities, authorities, and interrelationships of those who manage, perform, or verify work affecting biobank output. 5 structural requirements. 5.9 Biobank shall have personnel with authorities and resources including Black Small Square available to implement, maintain and improve the management Black Small Square system, Black Small Square able to identify deviations in the management system or biobanking Black Small Square procedures, Black Small Square able to assess the impact of deviations, and develops/implements appropriate actions. Black Small Square report to biobank management the performance of the QMS and needs for improvement. 5 structural requirements. 5.10 Biobank management responsibilities. Black Small Square changes to QMS monitored and controlled. Black Small Square ensure communication with interested parties, including personnel, on performance indicators of QMS and need for improvement. Black Small Square, the importance of meeting the standard requirements is communicated and understood by biobank personnel. Question. Any questions? 6 resource requirements. 6.1 General. 6.1.1 Available resources. Black Small Square biobanks to have available personnel, facilities, equipment, systems, and support services necessary to manage and perform biobanking. 6.1.2 Biobank Black Small Square to have a documented strategy for continued financial viability strategy to be reviewed periodically. 6 resource requirements. 6.2 Personnel. 6.1 Impartiality. Black Small Square all personnel, internal or external, associated with the biobank that could influence the biobank shall act impartially. 6.2 confidentiality. Black Small Square all personnel having access to confidential data shall be bound to confidentiality. 6 resource requirements. 6.2 Personnel. 6.2 3 Biobank Black Small Square shall have documented procedures and records for personnel management. 6.2 4 Biobank Black Small Square shall have detailed job descriptions communicating personnel duties, responsibilities, and authorities. 6.2 5 Biobank Black Small Square shall ensure health and safety requirements are meet. Black Small Square level of safety training shall be determined from a risk assessment of the biological and chemical material, processes, and equipment. 6 resource requirements. 6.2 Personnel. 6.2.2 Competence and competence assessment. 6.2 1 Biobank Black Small Square shall define and document required competence for personnel Black Small Square, including support functions, IT, facility infrastructure. 6.2.2/3 Documentation of competency Black Small Square requirements to include education, qualification, training, technical knowledge, skills, and experience to perform assigned duties and activities. 6 resource requirements. 6.2 Personnel. 6.2.2 Competence and competence assessment. 6.2.2.4/5 Personnel. Black small square shall be subject to competence assessment according to established criteria. Black small square assessed at regular intervals. 6 resource requirements. 6.2 personnel. 6.2.3 training. 6 to 2 to 3 to 1 personnel black small square shall receive appropriate training to acquire necessary competence. Black small square regular updated to retain competence. Black small square training shall be documented. 6.2.3 supervision black small square personnel undergoing training black small square shall be supervised until biobank confirms competency. 6 resource requirements. 6.2 personnel. 6.2.3 training. 6.2.3.3 introduction. Black small square biobank shall have an introduction policy for new personnel. Black small square appropriate orientation shall be provided. Question. Any questions? 6 resource requirements. 6.3 facilities / dedicated areas and environmental conditions. 6.3.1 requirements for facilities and environmental conditions for biobanks shall be documented. 42. 6 resource requirements. 6.3 facilities / dedicated areas and environmental conditions. 6.3.1 biobank shall determine, control, and maintain facilities in condition required for conformity. Includes procedures to maintain fitness for purpose, biosafety, and security of biological material and data. 43. 6 resource requirements. 6.3 facilities / dedicated areas and environmental conditions. 6.3.2 biobank shall determine, control, and maintain facilities in condition required for conformity. Includes procedures to maintain fitness for purpose, biosafety, and security of biological material and data. 44. 6 resource requirements. 6.3 facilities / dedicated areas and environmental conditions. 6.3.3 separation between areas. There shall be effective separation between biobanking areas that host incompatible activities. There shall be measures taken to avoid cross-contamination. 45. 6 resource requirements. 6.3 facilities / dedicated areas and environmental conditions. 6.3.4 biobank facilities and dedicated areas shall be suitable for biobanking and not affect intended purpose. 46. 6 resource requirements. 6.3 facilities / dedicated areas and environmental conditions. 6.3.5 biobank monitor, control, and record the environmental conditions in accordance with the relevant specifications, methods, and procedures. 47. 6 resource requirements. 6.3 facilities / dedicated areas and environmental conditions. 6.3.6 biobank should address future expansion requirements. 48. 6 resource requirements. 6.3 facilities / dedicated areas and environmental conditions. 6.3.7 biobank shall have a contingency plan to ensure required environmental conditions are maintained. Contingency plan should consider risk. 49. 50. This photo by unknown author is licensed under CC by NC. 6 resource requirements. 6.4 externally provided products and services. 6. Ford 1. 1 biobank shall A. Determine the requirements for externally provided processes, products, and services. B. Document requirements and communicate these to external provider. C. Retain information regarding communication. D. Ensure externally provided processes, products, and services conform to biobank requirements. 51. 6 resource requirements. 6.4 externally provided products and services. 6. 4.1 2 procedure and records. 4. Defining criteria for evaluation selection. Monitoring of performance and reevaluation of external providers. Retain documented information, including any actions arising from the evaluations. 52. 6 resource requirements. 6.4 externally provided products and services. 6 to 4. 1. 3 biobank shall determine which externally provided processes shall be communicated to the provider / recipient / user. 53. 6 resource requirements 6.4 externally provided products and services. 6 to Ford 1 for Biobank shall ensure externally provided processes, products, services have no adverse effect on Biobank's ability to operate shall determine risks associated with externally provided processes, products and services, steps taken to avoid negative effects on conformity of product. 54. 6 resource requirements 6.4 externally provided products and services. 6 to Ford 1 to 5 Biobank shall determine verification necessary to ensure externally provided processes, products, and services meet the Biobank's requirements. Requirements. 55. 6 resource requirements 6.4 externally provided products and services. 6. Ford 1. 6. If Biobanks uses externally provided preservation, storing, and or authentication activities. All processes need to be validated according to provisions. Internal audits conducted on provision of services and scheduled regularly using a risk-based approach. Relevant documentation related to activities is retained. 56. 57. This photo by unknown author is licensed under CC by NC. 6 resource requirements 6.5 equipment and software. 6.5.1 availability of equipment. Biobank has controlled access to all equipment required for performance. 58. 6 resource requirements 6.5 equipment and software. 6.5.2 Biobank shall establish, document, and implement procedures for all equipment, including controlled implementation, safe handling, storage, planned maintenance, calibration. 59. 6 resource requirements. 6.5 equipment and software. 6.5.3 Biobank shall have instructions on use and operation of all equipment. 60. 6 resource requirements 6.5 equipment and software. 6.5.4 Biobank shall categorize equipment, including backup equipment, with potential to impact quality of biological material in order to categorize equipment critical for biobanking. 61. 6 resource requirements 6.5 equipment and software. 6.5.5 Biobank shall maintain an equipment list detailing categorization, performance, maintenance, verification/validation. 62. 6 resource requirements 6.5 equipment and software. 6.5.6 Biobank shall verify on installation and before use that equipment is capable of achieving necessary performance and complies with relevant requirements. 63. 6 resource requirements 6.5 equipment and software. 6.5.7 critical equipment shall be capable of achieving the accuracy required and support compliance with required processes. 64. 6 resource requirements. 6.5 equipment and software. 6.5.8 Biobank shall retain documentation for critical equipment, including A, equipment and software identity, B, manufacturer's name, identification, serial number, and unique identification, C. Check equipment complies with specifications, D, current location where appropriate, E, manufacturer's instructions, F, results, reports, certificates of calibrations, adjustments, acceptance criteria, and dates, G. Due date of next calibration, H. Maintenance plan and maintenance history, I. Any. Damage, malfunction, modification, or equipment repair. 65. 6 resource requirements. 6.5 equipment and software. 6.5.9 critical equipment and software shall be safeguarded from adjustments which would invalidate output. 66. 6 resource requirements 6.5 equipment and software. 6, 5, 10 Biobank shall, where applicable, establish and maintain metrological traceability of its measurement results. 67. 6 resource requirements 6.5 equipment and software. 6.5 11 equipment shall be taken out of service to prevent use if subject to mishandling/overloading generates compromised outputs/results, is defective or outside specification limits shall be isolated and clearly labeled until repaired and shown by calibration/test to perform correctly. 68 6 resource requirements 6.5 equipment and software. 6.5 12 biobanks shall examine the effect of defect or departure from specifications. Refer to 7.11. 69 70 this photo by unknown author. 7 process requirements 7.1 general. 7.1.1 life cycle stages of biological material and associated data shall be identified and processes shall be defined and verified. Workflow shall describe stages with detailed procedures for each process: collection, accession, identification, preservation, storage, quality control, transport, disposal. Procedures shall be documented, implemented, and specific to biological material and associated data. All critical activities in each procedure shall be identified and documented. 71. 7 process requirements. 7.1 general. 7.1.2 all procedures and processes shall be kept up to date and shall be readily available to personnel. 72. 7 process requirements. 7.1 general. 7.1.3 date for critical stages/processes shall be documents in a standard format. 73. This photo. 7 process requirements 7.2 collection of biological material and associated data. 7.2.1 documented information requirements. 7.2. 1. Where the biobank collects biological material, it shall define and document information related to the collection, shall include the date, time, place, and procedure of collection and other relevant information. 75. 7 process requirements 7.2 collection of biological material and associated data. 7.2.1 documented information requirements. 7.2. 1. 2. Where the biobank acquires biological material. Biobank not responsible for collection. It should define the required information. It should retain appropriate documentation related to the collection procedure. 76. 7 process requirements 7.2 collection of biological material and associated data. 7.2.2 pre-acquisition information. 7.2.2. 1. Where possible, the biobank shall document/retain any information related to stages prior to the reception of the biological material that can affect the properties of the biological material to allow assessment of its fitness for the intended purpose. 77. 7 process requirements 7.2 collection of biological material and associated data. 7.2.3 collection procedure. 7.2.3 1 collection procedure shall be defined either by biobank/recipient/user according to the intended use of the biological material, proven techniques, or standards. 78. 7 process requirements 7.2 collection of biological material and associated data. 7.2.3 collection procedure. 7.2.3.2 where relevant pre-analytical workflows should be implemented according to ISO requirements, e.g. ISO 15189, 17025. 79. 7 process requirements 7.2 collection of biological material and associated data. 7.2.3 collection procedure. 7.2.3 qualified and authorized personnel shall collect the biological material according to defined procedures, where clinical material collection and evaluation of material needs to be by competent personnel. Collection shall never affect patient care and diagnosis. 80. 7 process requirements 7.2 collection of biological material and associated data. 7.2.3 collection procedure. 7.2.3 For collection of human biological material shall be performed in accordance with relevant ethical requirements, include ethical approvals or donor consent waiver. 81. 82. This vote 7 process requirements 7.3 reception and distribution of biological material and associated data 7.3.1 access principles 7 3 1 principles governing access to and distribution of biological material and associated data shall be defined, documented, and where required published. Biobank shall ensure documented requirements with interested parties comply with these principles. 83. 7 process requirements 7.3 reception and distribution of biological material and associated data 7.3.2 reception 7 3.2 1 biobanks shall establish, document, implement procedures for receiving or acquiring biological material and associated data. 84. 7 process requirements 7.3 reception and distribution of biological material and associated data. 7.3.2 reception 7 3.2 2 biobanks shall define acceptance criteria of biological material and associated data, including biosafety, biosecurity, intellectual property rights. Identification of biological material and associated data shall be verified on acquisition, reception, according to defined acceptance criteria. 85. 7 process requirements 7.3 reception and distribution of biological material and associated data 7.3.2 reception 7 3.2 3 when applicable, the biobank shall authenticate the biological material according to relevant international standards. 86. 7 process requirements 7.3 reception and distribution of biological material and associated data. 7.3.2 reception 7 3.2 for all biological material and associated data acquired by a biobank, individually or part of a collection, shall be segregated from final storage until legal, ethical, documentation, quality compliance has been assessed and managed. 87. 7 process requirements 7.3 reception and distribution of biological material and associated data. 7.3.2 reception 7 3.2 5 biobank should obtain relevant documented information needed to assess fitness for the intended purpose of the acquired biological material. 88. 7 process requirements 7.3 reception and distribution of biological material and associated data 7.3.2 reception 7 3.2 6 where the biobank has not been responsible for collection / sampling, this shall be documented. 89. 7 process requirements 7.3 reception and distribution of biological material and associated data. 7.3.3 distribution 7 3.3 1 distribution and exchange of biological material and associated data shall be in accordance with the biobank's access principles, reporting specifications, other relevant requirements, including materials / data transfer agreements. 90. 7 process requirements 7.3 reception and distribution of biological material and associated data. 7.3.3 distribution 7 3.3 2 biobank shall ensure that a documented / legally binding agreement is used that outlines conditions for provision and use when providing biological material and data. Any changes to such documents shall be documented. 91. 7 process requirements 7.3 reception and distribution of biological material and associated data 7.3.3 distribution 7 3.3 biobank shall establish, document, implement procedures for the preparation and distribution of biological material and associated data. Biobank needs to fulfill conditions of documented agreement. 92. 7 process requirements 7.3 reception and distribution of biological material and associated data. 7.3.3 distribution 7 3.3 4. When distributing biological material and associated data to recipient/user, predefined information according to 7.12 shall be provided, unless by agreement. 93. 94. 7. Process requirements 7.4 Transport of biological material and associated data 7.4.1 Biobank shall establish, document and implement procedures for shipping and receiving biological material, including conditions for the maintenance of biological material integrity. 95. 7. Process requirements 7.4 Transport of biological material and associated data. 7.4.2 Biobank shall maintain chain of custody for all biological material from point of dispatch to point of receipt when shipping can alter quality, or it is deemed necessary. Biological material shall be tracked, monitored for elements pertinent to integrity, including duration, temp, humidity, light. The chain of custody shall detail any deviations from specified parameters. See 7.11. 96. 7. Process requirements 7.4 Transport of biological material and associated data. 7.4.3 Biobank shall have procedures for safe handling, packaging, transport, reception of biological material. 97. 7. Process requirements 7.4 Transport of biological material and associated data 7.4.4 Biological material should not be left unattended, unless in designated custody zones. 98. 7. Process requirements 7.4 Transport of biological material and associated data 7.4.5 Only competent personnel shall prepare biological material for shipment. 99. 7. Process requirements 7.4 Transport of biological material and associated data. 7.4.6 Prior to transfer of biological material, the requirements for use, see 7.3.3.2, shall be fulfilled and arrangements in place for biological material distribution and reception with relevant parties. 100. 7. Process requirements 7.4 Transport of biological material and associated data. 7.4.7 Biobank shall establish and document procedure for shipping and receiving data. Data transfer shall be designed to ensure integrity and prevent breach of data privacy. Prior to data transfer, arrangements shall be made for data reception and distribution between parties. 101. 100. 7. Process requirements 7.5 Traceability of biological material and associated data. 7.5.1 Biobank shall ensure traceability of biological material and associated data over the life cycle, including collection/acquisition, reception, distribution, disposal/destruction. Biological material shall be uniquely identified/tagged so ID is maintained throughout lifecycle. Biobank shall have a documented procedure for tagging biological material that is compliant with environmental requirements, including relevant storage conditions. 103. 7. Process requirements 7.5 Traceability of biological material and associated data. 7.5.1 Biobank shall ensure traceability of biological material and associated data over the life cycle, including the biological material and associated data shall be linked to the documented permissions/restrictions for use. C. Inventory system shall allow for annotation and query of any relevant information associated with handling procedures, including collection, packaging, transportation, preparation, preservation, storing, and distribution. System should allow deviations in procedures to be flagged. 104. 7. Process requirements 7.5 Traceability of biological material and associated data. 7.5.1 Biobank shall ensure traceability of biological material and associated data over the life cycle, including d. Biobank shall establish a link between biological material and associated data for unambiguous traceability. E. Biobank shall be able to identify the location of any biological material and associated data at all times. F. Biobank shall be able to identify biological material and associated data already distributed to a recipient/user or already disposed of. 105. 7 Process requirements. 7.5 Traceability of biological material and associated data. 7.5.2 Biobanking information should be accessible to all persons querying the data as needed, including for inquiries regarding biological material distribution and complaints. 106. 7 Process requirements. 7.5 Traceability of biological material and associated data. 7.5.3 Biobank shall establish, document, and implement a procedure for the disposal and transfer of biological material and/or data due to a planned event or as a result of an emergency. 107. 7 Process requirements. 7.6 Preparation and preservation of biological materials. 7.6.1 Biobank methods of preparation and/or preservation shall be defined according to evidence-based documented processes, international standards, as agreed with provider/recipient/user. 109. 7 Process requirements. 7.6 Preparation and preservation of biological materials. 7.6.2 Critical activities in preparation/preservation shall be monitored and relevant parameters documented. Each preservation step shall be individually documented. 110. 7 Process requirements. 7.6 Preparation and preservation of biological material. 7.6.3 Date of preparation/preservation steps shall be documented in standard format. Time for each step should be documented in standard format. 111. 7.7.1 7 Process requirements. 7.7 Storage of biological material. 7.7.1 Biobank shall establish a disaster protection plan to include alternative methods of safeguarding to avoid loss of biological material. 113. 7 Process requirements. 7.7 Storage of biological material. 7.7.2 Biobank shall have a documented procedure in place for the storage and tracking of biological material, including A. Tagging information containing unique identifier of biological material. B. Type of container and environmental conditions for biological material storage. C. Mechanism for traceability. D. Short-term backup plan for maintaining accurate storage conditions/temperatures in case of emergency challenges in maintaining defined storage conditions. 114. 7 Process requirements. 7.7 Storage of biological material. 7.7.3 Critical activities during storage shall be measured, monitored, and documented. Date and time of critical activities, and when personnel access the biological material shall be documented. 115. 7 Process requirements. 7.7 Storage of biological material. 7.7.4 Biobank shall document and verify the storage location of all biological material, and associated data traceability shall be ensured at all times. 116. 7 Process requirements. 7.7 Storage of biological material. 7.7.5 Biobank storage locations and processes shall be designed to minimize risk contamination and to ensure maintenance of biological material integrity. 117. 7 Process requirements. 7.7 Storage of biological material. 7.7.6 Biobank storage conditions shall comply with facility requirements and environmental conditions. 6.3. 118. 7 Process requirements. 7.7 Storage of biological material. 7.7.7 Biobank shall verify the biological material inventory at planned intervals by a defined procedure. 119. 7 process requirements. 7.7 storage of biological material. 7.7.8 Biobank shall establish, document, and implement procedures supporting the patient/donor right to withdraw consent for storage and use of biological material and associated data. 120. 7 process requirements. 7.8 quality control of biological material and associated data. 7.8.1 General 7. 8. 1 critical activities that have an impact on quality of biological material and associated data shall be identified. Biobank shall establish, document, and implement QC procedures related to such activities. 121. 120. This vote 7 process requirements. 7.8 quality control of biological material and associated data. 7.8.1 General 7. 8. 1. 2 Biobank shall provide biological material and associated data fit for purpose. Biobank shall define minimum set of QC procedures to be performed on biological material and associated data. Exceptions can be justified for rare or legacy biological material and associated data and QC procedures which lead to biological material elimination. 123. 7 process requirements. 7.8 quality control of biological material and associated data. 7.8.1 General 7. 8. 1. 3 QC procedures shall A. Be according to proven techniques and fitness for purpose. B. Be regularly updated. C. Ensure all requirements are met where possible. 124. 7 process requirements. 7.8 quality control of biological material and associated data. 7.8.2 quality control of processes. 7. 8. 2. 1 Biobank shall establish, document, and implement QC procedures throughout the biobank process. Needs to include QC corresponding to predefined specifications. QC needs to demonstrate fitness for intended purpose of biological material and associated data. 125. 7 process requirements. 7.8 quality control of biological material and associated data. 7.8.2 quality control of processes. 7. 8. 2 QC activities shall be performed at planned intervals. Biobanks shall retain documented information of QC activities and results. 126. 7 process requirements. 7.8 quality control of biological material and associated data. 7.8.2 quality control of processes. 7. 8. 3 QC data shall be analyzed if defined QC criteria are not met. Actions shall be taken to control reporting of invalid data and / or distribution of non-compliant biological material and associated data. 127. 7 process requirements. 7.8 quality control of biological material and associated data. 7.8.2 quality control of processes. 7. 8. 4 Biobanks shall ensure that identified limitations are clearly documented and communicated to the user during product distribution. It is the responsibility of the recipient/user to decide on the acceptance of receiving material and associated data with documented and communicated limitations. 128. 7 process requirements. 7.8 quality control of biological material and associated data. 7.8.2 quality control of processes. 7. 8. 5 Biobank shall ensure information of QC results is provided to the user as specified by documented requirements. 129. 7 process requirements. 7.8 quality control of biological material and associated data. 7.8.2 quality control of processes. 7. 8. 6 QC results shall be periodically analyzed for trends and used as input for the continuous improvement process. 130. 7 process requirements. 7.8 quality control of biological material and associated data. 7.8.2 quality control of processes. 7. 8. 2. 7. Biobank shall document all process-related data in accordance with documentation requirements, Appendix A. 131. 7. Process requirements 7.8 Quality control of biological material and associated data. 7.8.2 Quality control of processes 7. 8. 2.8 Biobank should have appropriate QC materials, e.g. internal control material. QC material shall be periodically examined to assess quality characteristics of the biological material, including stability, performance of processing methods, and accuracy/precision of QC procedures. 132. 7. Process requirements 7.8 Quality control of biological material and associated data. 7.8.2 Quality control of processes 7. 8. 2. 9. Biobank shall use approaches to provide objective evidence to demonstrate comparability of biological material quality, processing, or testing output. This could include EQA programs, proficiency testing programs, interlaboratory comparisons. 133. 7. Process requirements 7.8 Quality control of biological material and associated data 7.8.2 Quality control of processes 7. 8. 2. 9 individual lab approaches including A. Reference material B. Previous samples C. Previously shared samples D. Control material that are tested regularly in EQA programs. 134. 7. Process requirements 7.8 Quality control of biological material and associated data. 7.8.2 Quality control of processes 7. 8. 2. 10 for interlaboratory comparison programs. The biobank shall monitor results of the program where criteria are not met. The biobank shall perform and document corrective actions. 135. 7. Process requirements 7.8 Quality control of biological material and associated data. 7.8.3 Quality control of data 7. 8. 3. 1. Biobank shall identify critical data and establish, document, and implement QC procedures applying to these critical data. 136. 7. Process requirements 7.8 Quality control of biological material and associated data 7.8.3 Quality control of data 7. 8. 3. 2. Biobank shall define type and frequency of QC performed. QC shall focus on accuracy, completeness, and consistency of data. 137. This photo 7. Process requirements 7.9 Validation and verification of methods. 7.9.1 General 7. 9. 1. Biobank shall use validated/verified methods for critical activities at all stages of the biological material life cycle. 139. 7. Process requirements 7.9 Validation and verification of methods. 7.9.2 Validation 7. 9. 2. 1. When the biobank provides/applies methods for critical activities. Biobanks shall ensure their methods have been validated to ensure fitness for purpose. If biobanks performs validation, it shall document and retain results obtained, details of the procedure used, and a fit for purpose statement. 140. 7. Process requirements 7.9 Validation and verification of methods. 7.9.2 Validation 7. 9. 2. Validation shall be as extensive as necessary and confirmed through objective evidence that specific requirements for intended use have been filled. 141. 7. Process requirements 7.9 Validation and verification of methods. 7.9.2 Validation 7. 9. 2. 3. When changes are made to validated methods, the impact of the changes shall be documented and a new validation carried out when required. 142. 7. Process requirements 7.9 Validation and verification of methods. 7.9.3 Verification 7. 9. 3. Validated methods used without modification shall be subject to verification by the biobank before use. 143. 7 process requirements, 7.9 validation and verification of methods. 7.9.3 verification 7. 9. 2 biobank verification shall confirm through objective evidence that method set criteria have been met. 144. 7 process requirements, 7.9 validation and verification of methods. 7.9.3 verification 7. 9. 3 biobank shall document procedure used for verification and results obtained. 145. This photo 7 process requirements 7.10 management of information and data. 7.10.1 biobank shall define required information and related data to biological material. Biobank shall have a system in place for tracking information and data. Biobank shall reasonably support interoperability of information and data. 147. 7 process requirements 7.10 management of information and data. 7.10.2 biobank shall address future capacity expansion to allow further addition of biological material processing data. 148. 7 process requirements 7.10 management of information and data. 7.10.3 biobank shall have in place a procedure for the implementation, modification, use for the computer system, software, hardware, and database in place. Procedure shall include data integrity, security control, and backup systems to prevent loose or corruption of data. 149. 7 process requirements 7.10 management of information and data. 7.10.4 biobank shall have access to the data and information needed to provide a service specified by contractual arrangements. 150. 7 process requirements 7.10 management of information and data. 7.10.6 biobank shall retain access to the appropriate data associated with the biological material as necessary for research purposes and in compliance with applicable requirements. 7. 3.3.2. 151. 1. This 7 process requirements 7.11 non-conforming output. 7.11.1 general 7.11.1 biobank shall establish, document, and implement procedures for management of output that does not conform to predefined biobank/recipient/user/provider requirements. 153. 7 process requirements 7.11 non-conforming output. 7.11.1 general 7. 1. 2 biobanks shall ensure that output that does not conform to requirements is identified and controlled to prevent unintended use/supply. 154. 7 process requirements 7.11 non-conforming output. 7.11.1 general 7. 1. 3 biobanks shall implement procedures to disclose information about non-conforming output to relevant parties, recipients/users, to determine fitness for intended purpose. 155. 7 process requirements 7.11 non-conforming output. 7.11.1 general 7. 1. 4 biobanks shall take appropriate corrective action based on the non-conforming output and its effect on fitness for purpose/use. This shall also apply to non-conforming output detected after supply of biological material and associated data. 156. 7 process requirements 7.11 non-conforming output. 7.11.1 general 7. 1. 5 procedure for non-conforming output shall address A. Responsibilities and authorities for the management of non-conforming output. B. Evaluation of the significance of non-conforming output, including the effect on further use of the output. C. Decision on the acceptability, segregation, containment, return, Suspension of provision or recall of the non-conforming output. 157. 7 process requirements 7.11 non-conforming output. 7.11.1 General 7. 1. 5 procedure for non-conforming output shall address D. Persistence of non-conforming output when 1. Remedy of non-conformity impossible. 2. Remedy of non-conformity is impractical. 3. Output can have an impact on results produced by third parties. E. Communication of non-conforming output and authorization for acceptance by recipient/user. 158. 7 process requirements 7.11 non-conforming output. 7.11.1 General 7. 1. 6 procedures for non-conforming output shall also apply to biological material and associated data collected or acquired prior to the first adoption of this document. 159. 7 process requirements 7.11 non-conforming output. 7.11.2 Control of non-conforming output. 7. 2. One biobank shall mitigate impacts on non-conformity. Implement corrective actions in proportion to the risk presented by non-conforming output and prevent recurrence. Remedial actions appropriate to effects shall be taken within defined limits and shall be controlled when non-conforming output is corrected. 160. 7 process requirements 7.11 non-conforming output. 7.11.2 Control of non-conforming output. 7. 2 biobank shall retain documents regarding non-conformance. See 8.7.3. 161. 7 process requirements 7.11 non-conforming output. 7.11.2 Control of non-conforming output. 7. 3 The decision on recall shall be taken in a timely manner to limit the use of non-conforming output. 163. This photo. 7 process requirements 7.12 report requirements. 7.12.1 General 7. 1. One biobank shall provide a report that shall include required information as agreed on in the documented agreement with recipient/user. Reports can be called certificates. 164. 7 process requirements 7.12 report requirements. 7.12.1 General 7. 2 report may be issued as hard copy or by electronic data transfer or by an electronic data entry in an accessible database. 165. 7 process requirements 7.12 report requirements. 7.12.1 General 7. 3 biobank should include statements specifying that report should not be reproduced except in 166. 7 process requirements 7.12 report requirements. 7.12.2 Content of the report. 7. 1. Each report shall include, unless a valid reason not to, a title. B. Name and address of biobank and location where activities in the report were carried out if different. C. Date of report issue. D. Unique ID of report with ID on each page to ensure that each page is recognized as part of report and clear identification of report. And E. Biological material identification or specific properties. 167. 7 process requirements 7.12 report requirements. 7.12.2 Content of the report. 7. 1. Each report shall include, unless a valid reason not to, F. Quality information of biological material and associated data. G. Methods used for identification/characterization of biological material. H. Testing results with units of measurement. I. Methods for testing. J. Methods for collection/acquisition/preparation/preservation. K. Storage conditions. L. Names and function of person authorizing report. 168. This photo. 7 process requirements. 7.13 complaints. 7.13.1 Biobank shall establish, document, and implement procedures to receive, evaluate, and make decisions on complaints. 170. 7 process requirements. 7.13 complaints. 7.13.2 A description of the handling process for complaints shall be made available upon request. On receipt of a complaint, the biobank shall confirm if it relates to biobank activities, and if so shall address it. Biobank shall be responsible for all levels of complaint handling. 171. 7 process requirements. 7.13 complaints. 7.13.3 complaint handling process shall include: A. Description of process for receiving, accepting, investigation complaint, and deciding what responsive action required. B. Tracking and recording complaints, including resolving action. C. Ensuring appropriate action taken. 172. 7 process requirements. 7.13 complaints. 7.13.4 Biobank receiving complaint shall be responsible for verifying all information necessary to accept complaint. Biobank shall acknowledge receipt of complaint. 173. 7 process requirements. 7.13 complaints. 7.13.5 Biobank shall provide complainant with progress report where possible. 174. 7 process requirements. 7.13 complaints. 7.13.6 Impartial review shall be performed for each complaint. Outcome of review shall be communicated to relevant parties. 175. 7 process requirements. 7.13 complaints. 7.13.7 Biobank shall give formal notice of complaint handling to complainant where possible. 176. This 8 management system requirements. 8.1 options. 8.1.1 general. 8.1.1 management system supports and demonstrates the consistent achievement of the requirements of the standard, assures the quality of the biobank results, allows the requirements of clauses 4 to 7 to be met, is in accordance with either option A or option B. 178. 8 management system requirements. Option A. 8.2 documented information for the quality management system. 8.2.1 Biobank shall manage the internal and external documented information necessary for planning and operation in order to comply with requirements and demonstrate competence. This shall include: A. Identify information to be documented. B. Ensure documented information is created and updated as required. C. Ensure documented information is controlled. 179. 8 management system requirements. Option A. 8.2 documented information for the quality management system. 8.2.2 policies and objectives are established, documented for the fulfillment of the standard, are acknowledged and implemented at all levels of the biobank. 180. 8 management system requirements. Option A. 8.2 documented information for the quality management system. 8.2.3 competence, impartiality, and consistent operations are addressed by the policies and objectives. 181. 8 management system requirements. Option A. 8.2 documented information for the quality management system. 8.2.4 biobank management shall provide evidence of commitment to the development and implementation of the quality management system, continually improves the quality management system's effectiveness. 182. 8 management system requirements. Option A. 8.2 documented information for the quality management system. 8.2.5 all documentation, processes, systems, and records related to the fulfillment of the requirements of this document shall be included or referenced to the quality management system. 183. 8 management system requirements. Option A. 8.2 Documented information for the quality management system. 8.2.6 Access to parts of the management system is available to all personnel. 100 8 Management System Requirements Option A. 8.3 Control of Management System Documents. 8.3.1 Control of documents must include both internal and external documents relating to the fulfillment of the requirements of the standard. 186. 8 Management System Requirements. Option A. 8.3 Control of Management System Documents. 8.3.2 Document Control Process. A. Documents are approved by authorized personnel prior to issue. B. Documents are periodically reviewed and updated as necessary. C. Changes and current revision status of documents are identified. D. Relevant versions of documents are available and their distribution controlled as necessary. E. Documents are uniquely identified. F. Unintended use of obsolete documents is prevented and they are clearly identified as obsolete if retained. 187. 1. This vote 8 Management System Requirements Option A. 8.4 Control of Records. 8.4.1 Biobank shall establish and maintain legible records to demonstrate fulfillment of the requirements of the standard. 189. 8 Management System Requirements Option A. 8.4 Control of Records. 8.4.2 Controls of Records are implemented for -identification -storage -protection -backup -archive -retrieval -retention times -disposal are established for -retention periods to satisfy contractual/legal obligations -confidentiality commitments -access and availability. 190. 8 Management System Requirements Option A. 8.4 Control of Records. 8.4.3 Access to records shall be consistent with confidentiality arrangements, be readily available. 191. 1. This photo 8 Management System Requirements Option A. 8.5 Actions to address risks and opportunities. 8.5.1 Risks and opportunities are considered with biobank activities. A. To assure the management system achieves its intended goals. B. To achieve the biobank objective. C. To prevent or minimize undesired impacts and potential failures, including biobank discontinuation. D. To achieve continuous improvement. 193. 8 Management System Requirements Option A. 8.5 Actions to address risks and opportunities. 8.5.2 Biobank shall develop, implement, and document. A. Action plan to address risks and opportunities. B. Action plan to safeguard biological material and associated data in event of disaster. C. Action plan for discontinuation of operations, a legacy plan. D. Approaches to implement actions into QMS, evaluate effectiveness of actions in case of closure, handle the end of business. 194. 8 Management System Requirements Option A. 8.5 Actions to address risks and opportunities. 8.5.3 Actions to address risks and opportunities are proportional to the potential impact on the validity of the biobank. 195. This vote 8 Management System Requirements Option A. 8.6 Improvement. 8.6.1 Biobank shall identify opportunities for improvement and any necessary action implemented. 197. 8 Management System Requirements Option A. 8.6 Improvement. 8.6.2 Customer Feedback. Both positive and negative are sought, analyzed, and used to improve the management system, biobank activities, and customer service. 100. 8 Management System Requirements Option A. 8.7 Corrective Actions. 8.7.1 Nonconformities. When occur, the biobank shall A. react, and, as applicable, take action, correct the issue and address the consequences. B, evaluate the need for action to eliminate the cause so that it does not recur. C, determine if similar non-conformances exist, review the effectiveness of any corrective action, update any risk and opportunities, makes any necessary changes to the management system. 200. 8 Management System Requirements. Option A. 8.7 Corrective Actions. 8.7.2 Corrective action taken is appropriate to the effects of the nonconformity. 201. 8 Management System Requirements. Option A. 8.7 Corrective Actions. 8.7.3 Records retained. A, of the nature of the nonconformity, causes and any actions taken. B, of the outcomes of corrective action. 200. This photo. 8 Management System Requirements. Option A. 8.8 Internal Audits. 8.8.1 Biobank Audit Requirements. A, is planned and implemented, including frequency, defined responsibilities, and reporting, taking into account minus the importance of the biobank activities concerned minus changes affecting the biobank minus the results of previous audits. B, audit criteria and the scope of each audit are defined. C, audit results are reported to relevant management. D, corrective actions, where necessary, are implemented promptly. E, records of the audit program, including outcomes, are retained. 204. 8 Management System Requirements. Option A. 8.8 Internal Audits. 8.8.2 Conducted at planned intervals. A, to establish whether the management system. B, conforms to minus the biobank's requirements, including biobank activities minus the requirements of the standard, is effectively implemented and maintained. 205. 206. This photo by unknown. 8 Management System Requirements. Option A. 8.9 Quality Management Reviews. 8.9.1 Review of Management System is conducted at planned intervals by biobank management to ensure minus continued suitability, adequacy, and effectiveness. Minus covers the stated policies and objectives related to the fulfillment of the standard. 207. 8 Management System Requirements. Option A. 8.9 Quality Management Reviews. 8.9.2 Inputs to management review shall be documented and include. A, changes in internal and external issues relevant to biobank. B, fulfillment of objective. C, suitability of policies and procedures. D, status of actions from previous management reviews. E, outcomes of recent internal audits. 208. 8 Management System Requirements. Option A. 8.9 Quality Management Reviews. 8.9.2 Inputs to management review shall be documented and include. F, corrective actions. G, assessment by external bodies. H, changes in volume, type, and range of biobank activities. I, provider/recipient/user feedback. J, complaints. 209. 8 Management System Requirements. Option A. 8.9 Quality Management Reviews. 8.9.2 Inputs to management review shall be documented and include. K, effectiveness of any implemented improvements. L, adequacy of biological material and associated data. M, results of risk identification. N, outcomes of the quality control. O, any other relevant factors including monitoring activities and training. 210. 8 Management System Requirements. Option A. 8.9 Quality Management Reviews. 8.9.3 Records of outputs include all decisions and actions relating to. A, effectiveness of the management system. B, improvement of activities relating to satisfying the requirements of the standard. C, provision of required biological material and associated data. D, any need for changes. 200. Thank you.